This is an ABC podcast.
Today in New Zealand, the World Health Organization released its guidelines for housing and health. The link between the two is strong. Globally, there are millions of avoidable deaths each year from respiratory diseases, other infections, lead poisoning, high and low indoor temperatures and fires. And we in Australia harbour such housing problems, especially in Aboriginal communities. But myths abound about what these problems are and what causes them. The other day I spoke to the person launching the WHO guidelines, David Jacobs, who's Chief Scientist at the National Centre for Healthy Housing in the United States, and Paul Torzillo, who's a respiratory physician at the University of Sydney with a long interest in Aboriginal health and housing. David Jacobs.
We know, for example, in New Zealand that 10% of hospital admissions per year are attributed to household crowding. We know that India recorded over 2,600 deaths in 2012 due to collapsing buildings. In Kyrgyzstan, we have data showing that household crowding causes deaths from tuberculosis.
And even in Europe, quite a high level of disease burden.
Yes, we know that 15% of new childhood asthma cases in Europe can be attributed to indoor dampness and the mold that comes out of it.
David, what do the guidelines recommend?
Principally, the guidelines deal with crowding, indoor cold and insulation, indoor heat, home-based injuries, and accessibility.
Overcrowding is hard to deal with because that's an economic issue.
Well, part of the definition of healthy housing is also affordable housing. It doesn't make any sense to treat a child with an asthma attack in the hospital only to have the child return to the home environment that made him sick in the first place. We're shifting the costs of inadequate housing to our medical care sector. So ideally what we want to do is prevent the diseases in the first place by modifying housing conditions that produce the disease.
And how modifiable are we? Just take Europe, for example. You've got a large housing stock, which is pre-glasnost, which are notorious for being damp, having no insulation, no air conditioning, communal heating, which often breaks down. So you're fine having the WHO guidelines, but what are you going to do about these massive Leninist apartment blocks? We'll come to Australia in a minute.
Well, so controlling moisture is tied to how you ventilate housing. There are established procedures for how to do that, preventing leaks through the envelope, dealing with airflow balances so that there isn't the kind of condensation that might occur, proper insulation, especially in the era of climate change.
Paul, you've spent a lot of your career looking at Aboriginal housing and the health problems that arise from that. And if you talk to Aboriginal communities and you say, what's the one thing that you would have in your community that would make the big difference? They almost always say housing and better housing. What's the situation in Aboriginal communities?
The situation's still poor. We started to look at this in the 1980s. We tried to define exactly what illnesses do they cause and what's the hardware, what's the stuff you need in a house to help you stay healthy. Be able to wash yourself, your kids, your blankets, your bedding, store, prepare, cook food, control temperature. We've then done about 25 years of work and we've found remarkably consistent findings. So when you go into an Aboriginal house across the country, we've looked at about 9,000 houses in about 230 communities, affecting about 60,000 people. You've got a functioning shower in about a third of those houses. You've got electrical safety in about 11%. 11%? 11%. And you can store, prepare and cook food in about 8%.
8%? And some of these houses are not old houses.
New houses don't seem to perform much better than old houses.
So they're badly built to start with?
When you look at this hardware, why does it fail? Particularly the electrical and plumbing issues, why do they fail? 8% of them fail because of overuse or damage or anything you might even refer to as vandalism. A quarter of this is due to bad installation, poor initial construction, bodgy work, not properly inspected before the houses were built. But 70% is due to a lack of routine maintenance that any house would need.
So this is stuff that would go wrong in any house, but it doesn't get fixed.
It doesn't get fixed, and that's because maintenance is not planned or funded or conducted. So what we
people
need...
think, I built a house, I built 20 houses in an Aboriginal community, I've done my job, move on to the next Aboriginal community and just be proud of the houses you've built.
So if all we do is build new houses, we won't fix this problem. And one issue is getting sustainable local maintenance programs happening in a long-term fashion in communities across the country where we do proactive surveillance. So you try and check things before they break down, costs less to fix, keeps the house healthier. Despite this 25 years of work, we've not really been able to make a sustainable major impact on housing policy, and Indigenous housing policy remains this intractable, unsolvable problem.
And the National Partnership on Remote Housing hasn't been renewed.
It hasn't been. So one of the things that the Henry Halloran Trust funded...
Henry Halloran Trust?
Henry Halloran Trust is a philanthropic trust attached to Sydney University that does housing research and facilitated David coming through here. They've also funded a Housing for Health incubator research program led by Professor Tess Lee at Sydney Uni, looking at a number of issues, but particularly looking at why is this such an intractable issue.
If you talk to Aboriginal communities, they say, you've got all these white folks coming in and telling us what to do and don't actually involve us. And if they actually talk to us, we would come up with solutions for you. You're trying to impose stuff on us rather than working with us.
Well, I've never been to an Aboriginal community where they said we don't want our toilet to work. I've never been to one where they said we don't want to be able to wash our kid. And I've never been to one, especially lately, that didn't say it's too hot and it costs us too much to control the temperature. So the question is, how do you respond to those requests?
In a sustainable way.
In a sustainable way.
Well, I'm looking at you.
There obviously needs to be new housing because there's a housing deficit. But we think that unless we can implement these local sustainable maintenance programs with access to electricians and plumbers,
carpenters,
across the country, we're not going to keep these houses functioning, and we're going to lose housing stock.
What are the health consequences of what you've just described?
The first is the high rates of infectious disease in Aboriginal kids, order of magnitude greater rates of respiratory infection and ear disease. There's lots of evidence that they are impacted on hugely by the ability to wash and keep yourself clean. If the hardware doesn't work, you won't be able to clean your kids, wash their face and hands. Childhood illness has a big impact on long-term chronic disease. Infective inflammatory conditions drive coronary artery disease. Early respiratory infection drives chronic lung disease, etc.
So describe a community to me in Australia where it's working.
Look, I think...
That was a long breath.
Yeah. I think the evidence is that housing hardware is in a pretty poor state right across the country. I think there are a number of communities in New South Wales where it's been improved because New South Wales has been the one state that's really taken up this work and focused on it. And I think one of the reasons is it's been incorporated into the health department rather than just left with housing. Labor and coalition governments have sustained it.
And what does WHO calculate as the return on investment in terms of health problems avoided?
There are returns on investment out of Europe and also out of the United States. There's basically $1 in cost for a $5 benefit in asthma-related home visits. For lead poisoning prevention, it's for each dollar in lead hazard control, you get back $1.36. So it makes financial sense. The problem is who pays the costs and who reaps the benefits. Right now, we're basically absorbing the costs of inadequate housing in our healthcare system, which doesn't make sense. But the housing providers don't make the health investments because they don't realize a return on that investment. So it's basically the classic market failure. We need to find ways, and that's what the WHO guidelines do. We need to find ways to concretely describe the housing characteristics that will have a health benefit.
Country towns in Australia have shortages of everything. It's not just doctors and nurses and psychologists, it's also tradespeople. Is anybody trying apprenticeship schemes in Aboriginal communities so that kids growing up have a trade?
The answer to that is yes in some places, but it's simplistic to think that that's something that's going to solve the problem. The numbers are small, it is happening around the country, but apprenticeships take a long time. They require someone to keep someone employed for a long time. This is a question of years.
So we do have to have fly-in, fly-out teams or what?
It'll be a mixture. So there'll be some places across the country where there will be local people who've got a trade skill and trades accreditation. There'll be other places where you'll have to bring people in and out. There has to be workarounds in different regions across the country which allow you to achieve your goals. Locally employed people looking at hardware, doing daily maintenance, who've got access to plumbers and electricians and tradespeople to come in and fix the problems that require tradies. And it'll work differently in different places across the country.
So if there's a tradie listening, we've got lots of tradies listening to Radio National, can they do, and they want to help, where would they go? What would they do?
I think there's lots of opportunities for tradies to help in this sort of stuff.
But is there an organisation that brings it together?
I guess there are different NGOs, there are groups of plumbers who work, there are groups of engineers who work. There's probably not an overarching easy access point for the whole of the country. If there is, I'm not aware of it.
In the U.S., we have a National Healthy Housing Training Center and Network. It's 20 universities. We train tradespeople, we train code inspectors and housing inspectors on how to recognize and mitigate housing-related health conditions. It's not something that tradespeople usually learn going through their apprenticeship.
And finally, what impact does climate change have on all this?
The energy consequences are profound. In the U.S., our weatherization program, which adds insulation and air sealing and the like, also includes some health interventions. If you think about it, it's kind of silly to go ahead and do the insulation but not fix the malfunctioning smoke alarm. So they're increasingly integrated. But our houses and the ventilation in them is a big energy penalty. If we're not smart about it, then we'll end up using more energy than is needed.
I mean, in some Aboriginal communities, they're living in summers now where it's above 45 degrees.
High 40s for a few weeks over this recent summer. Places in WA and Central Australia with temperatures of 51 and 52. Everybody acknowledges globally that climate change is going to impact on poor populations first and early and hardest. And Aboriginal people in lots of these communities are already being hit by that. The costs of thermal control are going to be prohibitive for those populations, and we need to be thinking about multiple approaches to that right now.
Thank you very much to you both.
Thank you.
David Jacobs, who's Chief Scientist at the National Centre for Healthy Housing in the United States, and Paul Torzillo, who's a respiratory physician at the University of Sydney with a long interest in Aboriginal health and housing.